I want to, first of all, say I align my concerns with Senator Roth with the 340B program, especially in some of the more rural areas where we have hospitals that if these drug discount programs are eliminated, they will close their doors and we'll have other problems on our watch. You mentioned in negotiating with similar pharmacological classes of drugs to put one on a formulary, and to answer Senator Monning's question, physicians can make the case through prior authorizations that this patient is allergic to this brand name drug and this drug works the same way, and therefore that's the only drug that they can be put on, and ultimately they do go on. The question is whether or not you can negotiate with them if they're not the drug of choice on a formulary. But one area that has seen significant increases, and you didn't address it, and that is the rising cost of generic drugs. We don't see the delivery of newer drugs coming on the market like we did in the 80s, 90s. Getting through the FDA is a very arduous, long, comprehensive process, and should be, because we want to make sure that drugs are safe and effective. But a way that drug companies are boosting their profits is taking drugs that, originally, as an example, 1,000 tetracycline used to cost us about $20, retail pharmacies. Now they've gone up to, in some cases, $500 to $1,000 a thousand. So it's not that the ingredients have gone up, it's just that they've decided that they're going to raise the price. So what I would encourage is that when you are looking for preferred drugs on a formulary list, that you need to look at manufacturers and get these manufacturers to compete with one another. Also, I think purchasing in volume is very, very important, especially if you're giving exclusivity to certain formularies. And it sounds like you do some of the bidding for the state of California. You don't do much for the University of California or Medi-Cal. So while I have never been an advocate of the expansion of government, I'm going to throw out an idea that I've mentioned before. I think we should form the California Department of Prescription Purchasing and Adjudication. And what I think the state of California should do is get into the PBM business. And we should have a state PBM that maybe could contract with Washington, contract with Oregon, do their adjudications. And instead of allowing these private companies to operate in a black box and extract billions of dollars away from lowering premiums and benefits for our beneficiaries, that we should be at that table. It sounds like to me what the state is trying to do is recreate the wheel that the PBMs have already done. But why should we, allow them to siphon off billions of dollars from the state of California when we have so many needs? We have a discussion today about providing care for undocumented people of all ages, to try to save the state money because we don't want them going to emergency rooms. We're talking about implementing a penalty to backfill the federal lack of a penalty. Having our own PBM, and by the way, the cost of that penalty is $500 million. Having our own PBM, ladies and gentlemen, can raise not $1 billion, but billions of dollars a year for the state of California to embark on some of the goals and aspirations that we all either embrace philosophically or partially. I throw this out there. This is a big idea, but California should look at big ideas and not recreate the wheel. My concern about what the governor's plan is that we're not going to see any of the fruits of our labors till 2021, 2022. You could form a PBM in 6 months, and you could have it operating very aggressively by next year. And if you form your PBM, you're not going to have to reach out to the drug companies. They're going to reach out to you, and you're going to have them lined up at a table. And believe me, you can get some significant breaks that are not publicly available because we don't know about how PBMs truly operate, but we do understand that what used to be a switch of 15 cents as a transaction mediator between a patient and an insurance company, you have companies like Express Scripts that have a value of $50 billion. Believe me, it's not from getting 15 cents a transaction transmitting prescription claims. So I say we ought to take that opportunity, investigate it, have our own California PBM, have our own department that oversees it, which will, I guarantee you, bring in thousands more that's going to cost us to create this department. We get it online faster, and we give the health care that our citizens deserve and need at the lowest cost possible. So I'd like to get your thoughts on this, this volley.
Thank you for the suggestion. I mean, we're in the early stages of implementation, and there are a lot of directions that we could go in. I'm glad that we're hearing ideas now about potential ultimate solutions. I would say we're acutely aware that in many, that in many cases, there's a significant amount of value that's being captured by the PBM that we don't necessarily know about because the payments aren't going to or from the state. This is more of an issue. DGS does very little work with PBMs. We use them on a limited basis for service delivery to certain populations that need to use a retail pharmacy. For the most part, we do not for our own activities as a purchaser. But the concept of finding ways to capture the value that the PBMs are currently capturing is an interesting idea, and it's something that we have talked about internally. I have not heard the idea of creating our own before, but I think a lot of possibilities are on the table.
Riverside County, when I was on the Board of Supervisors, we had a very bold idea. We wanted to embrace the PACE program to the Western Council of Governments and came up with a program where you could effectively and efficiently finance solar panels through your property taxes. It was such a great program, we said, well, why don't we expand it statewide? And as a result, we created savings for beneficiaries throughout the state of California. WRCOG, of course, got some additional revenue that they could provide for even more services to residents of Riverside County. If we set up the template of a state PBM and we could contract to states like Oregon and Washington, there could be some revenue streams even for the state of California, because why should the other states recreate the wheel? We've got the horsepower to do it with our population. I think it could be beneficial to many of the Western states that I think would be standing in line to join our efforts.
Okay, well, thank you very much.